Thank you everyone so much for being here. We also are doing this, recording it on Skype. So we have folks joining from the phone. So we'll be incorporating them into the conversation as well. And folks on Skype, if you can't hear, feel free to speak up or you can send a message and Adam is monitoring the Skype call. So he'll be able to respond to your messages. So welcome to the Bidders Conference for the Evidence-Based Health Promotion, RFP, from the Veteran Seniors and Human Services Levy. We use the term Bidders Conference, but it's not, it's kind of an obscure, weird term. Basically, this is an information session to talk about the RFP content and answer questions that you all might have about the RFP. And my name is Virginia Wise, and I'm on the seniors team of the Veteran Seniors and Human Services Levy team at the county. And I'm the person coordinating this RFP. So we start our levy meetings with an acknowledgement of native land. We would like to acknowledge that we're on the traditional land of the First People of Seattle, the Duwamish people and the Coastal Salish people, past and present, and we honor with gratitude the land itself and the Duwamish tribe. And you can visit the Duwamish tribe website for more information. So we'll start with a quick round of introductions. I think we can start here in the room and then we'll go to the Skype call. If you could just say your name and the organization you're with, that would be great. So maybe start over here.
I'm Lalita Uppala with the India Association of Western Washington.
My name is Simon Park. I'm from Providence.
My name is Michelle Yip. I'm with Providence.
Edna DeGray. I'm with the Wajo Dance Studio.
And I'm Joni. I'm just her driver and moral support.
I'm Milton Curris with Senior Fall Prevention Initiative.
I'm Nanda Tiwari. I'm with India Association of Western Washington.
Michael Root with the Athena Healthcare Center.
Jonathan Sherman, Global.
Hi everyone, I'm Celia Weissman and I'm with SHAD.
Hi, Christy Beckman with the Pike Place Market Foundation and Market Commons.
Dagmar Braun, South Park Senior Citizens.
Hi, I'm Faye Ariola with Asian Counseling and Referral Service.
Paige Dennison with Sound Generations.
Megan Thompson with Sound Generations.
Hi, Angela Miyamoto with Aging and Disability Services.
Hi, Mary Pat O'Leary with Aging and Disability Services.
Zaire Lauren, VSHSL, with Virginia and beginning.
Hey everyone, my name's Adam Schmidt. I'm the community liaison for the levy. And if you want to make sure you get all the updates, please sign in at the front so that you can catch every email and just hear more about who all is in the room and the Bidders Conference today.
Nikki, I'm one of the program specialists with the seniors team with the Levy with Virginia. Remind her what the morals of present.
And would folks on the phone like to introduce themselves?
This is Ann Turner from, sorry, getting some back. Ann Turner with the Health Promotion Research Center at the University of Washington.
Ann Turner.
I'm sorry, I did not get your passcode. Please try again.
That was Ann Turner with the University of Washington Health Promotion Research Center.
I'm sorry, I did not get your passcode. Please try again.
So we've got Jerry Chang online.
I'm sorry, I did not get your passcode. Call back when you can remember your passcode. Goodbye.
570566 여긴가? 어디다 하는 거죠? With the passcode.
Can you see? You can see. It's always a little tricky.
Jerry Chang and Ken On. Leah Westra from Health Promotion Research Center at the University of Washington. Katie Mahan and Kathleen Pierce with the Kelly Ross Speakers. And we have several on the phone as well. Renee, me, Young Willow,
Echeverria.
Echeverria.
From Interim CDA.
And we have 7 other guest speakers on the phone.
Myung Lee from Korean Women's Association.
with the J Chan. J Kang. Sorry.
Hi, this is Carrie Nass with the City of Renton.
Anyone else want to introduce yourselves? That's okay, you don't have to also, or you can type it up.
Should we mute our mics again?
Yeah, that would be great, thank you. And then if you have a question, you can, probably the best thing to do is type it in the box, or if you're on the phone, you can speak it out loud, but we will be holding time at the end for questions. All right.
This is Maria Ursua with the Seattle Housing Authority.
Seattle Housing Authority. All right, great, thank you. Yeah, and as Adam said, thanks for mentioning that. We have a sign-in sheet up here in the front for folks who are here and copies of the RFP and copies of our presentation today. So our agenda today, we're going to talk a little bit about the Veterans, Seniors, and Human Services Levy. We're going to review the details of this strategy and the RFP content. We're going to talk about technical assistance supports, which are available to small organizations who are applying to the RFP. And we're going to talk about Zoom Grants, which is our online platform that organizations use to apply. And then we'll have time for questions and answers. So what is the Veterans, Seniors, and Human Services Levy, the VSHSL? The Veterans, Seniors, and Human Services Levy was passed by King County voters in 2017, and this is actually the third round of the levy. It used to be the Veteran and Human Services Levy, so this is the first time that it's included funding specifically for seniors, and it's a really exciting new investment in senior services and supports in King County. And the levy is funding strategies in 5 results areas: housing stability, financial stability, social engagement, healthy living, and system access and improvement. And this investment is under healthy living. So some of the guiding principles of the levy: connection, belonging, and what can only the VSHSL do. This is a levy that, because we have money from property tax dollars, we have more flexibility than a lot of other state and federal funding sources. So we're really trying to maximize that flexibility and identify where there might be gaps in funding and how we can address those gaps. Equity and social justice is also a really key part of the levy and all the work we do in our department and in King County. Our overarching goal is to ensure that all people, regardless of where they are and who they are and where they live, have the opportunity to thrive with full and equal access to opportunities, power, and resources. I also want to mention some folks from ADS introduce themselves. They're a really key partner in this work and all the other work we're doing with seniors under the levy. The Aging and Disability Services is the state designated area agency on aging for King County and have held the work of aging services in this region for a long time. They're part of the City of Seattle Human Services Department. And we also have some funds from ADS for evidence-based senior health promotion that are actually part of this RFP that will come into play starting in 2021. Is there anything else you all want to mention about ADS?
No, I think you captured it, but just to be clear that, so the funds that we manage for health promotion, it is going to be part of this RFP. And so we're going to have the contracts through 2020, but starting in 2021, our health promotion funds will be managed and contracted with King County.
So the HL2A, Healthy Living 2A strategy, for all the investments we're making through the levy, the starting point for them is the implementation plan, which was part of the levy passage. And the implementation plan outlines kind of the basic tenets of these different investments. And this is really the starting point for us and then we take this and work to develop our RFPs based on additional research and community outreach. So the implementation plan for the levy describes, kind of outlines this issue as follows. Prevalent health issues like chronic conditions and falls play a crucial role in determining the ability of King County seniors to age healthily. Evidence-based senior health promotion programs improve senior health and are cost-effective, but they lack sufficient funding in King County. And significant health disparities exist among King County seniors based on race, ethnicity, and geography. So this was the starting point for us, and then you'll kind of see how this language carried out through the RFP. And this is some of the background. Now we're moving into some of the background information that's in the RFP. So kind of there's a section with an overview of senior health, a gradual decrease in physical and mental capacity, growing risk of disease, and age-related lifestyle changes are a normal part of the aging process, but there's also no typical senior health profile. People of the same age have a really wide range of health status, and a big part of that is social determinants of health, the access to people's access to social and economic resources that are hugely influential in shaping their health. By senior health promotion, we mean interventions designed to benefit and sustain senior health and quality of life, often by supporting individuals to take action in service of their own health. Some of the key issues within senior health that we've identified are health disparities. As investment, the implementation plan mentioned significant health disparities exist among King County seniors, and there's some examples here and some additional examples in the RFP. For example, there's a 5-year life expectancy difference between people in high income and low income parts of the county. Among the 60+ population in King County, African American and Hispanic Latino adults are 50% more likely, and American Indian, Alaska Native, and multiracial older adults 20% more likely to be in fair or poor health than white non-Hispanic adults. And some other data shows that Native Hawaiian and Pacific Islanders have health status similar to African Americans. And then also another key issue, falls prevention. Falls can cause debilitating injuries and initiate health declines in older adults, but there's a lot that can be done to prevent falls. So you'll see kind of as we continue our discussion how we're prioritizing funding these issues in the RFP. So the definition of evidence-based programs, a lot of people have a sense of what that is. We're operating with a pretty specific definition for the purposes of this RFP. Generally, evidence-based programs are kind of understood to be programs that are developed and proven effective for addressing specific health issues such as falls prevention, chronic disease, medication management, physical activity, etc. They're usually developed as a complete package with a comprehensive program model and supporting curriculum and materials that are ready to be implemented in different settings. The Federal Administration for Community Living, which administers the Older Americans Act funding, that's right? Okay. Provides a really specific definition of evidence-based senior health promotion programs. So I just want to show real quick this is the Administration for Community Living webpage that kind of details evidence-based programs, and the definition is down here. We included this definition and the link in the RFP, but just for your reference, this is a really helpful website. So that's the definition we're using for this RFP. And also you'll see just a note on these slides, there's a little parentheses down at the bottom saying which pages of the RFP this refers to. So if you're looking at this later, you can refer to that. Some examples of evidence-based senior health promotion programs, and this is also in the RFP and there's some more details about them. Chronic disease self-management program, which is a 6-week-long program for people with chronic conditions. Tomando Control de su Salud is a similar program for Spanish speakers specifically. Enhanced Fitness, which was developed right here in King County in Seattle by Sound Generations, is an ongoing group exercise and falls prevention program. Matter of Balance is a program designed to reduce the fear of falling and increase activity levels among older adults. Tai Chi Chuan, Moving for Better Balance, is a balance training program that is based on the traditional martial art and recreational activity of Tai Chi. And Wisdom Warriors was also based on the chronic disease self-management program, but it's specifically for Native American Indian older adults. So these are just a handful of examples of evidence-based senior health promotion programs. And that website that we were just looking at, the Administration for Community Living website, has a lot more information on programs and links to other resources where you can see other evidence-based programs. This second link here, which is also in the RFP, is an actual list of a lot of different evidence-based programs. It's linked from that website too, but it's a helpful way to just kind of see a summary of different programs and what issues they address and how much they cost. And then here's some other links to other evidence-based programs. So while there's many benefits to evidence-based programs, there's also some important challenges. One big one is that culturally grounded interventions developed in communities of color and other marginalized communities are often haven't reached the threshold of becoming evidence-based. There's a lot of research expertise and a lot of resources that are needed to make a program reach that threshold. So it means that that programs that are really culturally grounded and maybe very effective just don't reach the threshold of evidence-based and so thus don't qualify as evidence-based programs. When programs are tested for their effectiveness, they're often tested in a limited number of populations and under a limited range of conditions. So they're not always adaptable to different contexts and different populations. Similarly, there's limited room for adaptation. You saw that there's, I think the Tomando Control de Su Salud and the Wisdom Warriors program, they were kind of built from the chronic disease self-management program and then developed for specific populations. And that might be even more than an adaptation. They were kind of fashioned to serve those specific populations. But other programs can be adapted in different ways by translating language or changing some of the context to make it match better with the population that's participating. But there's often limited room to do that because the program has been tested and found to be effective by following a certain program model. So you can't always deviate that much from the program model. And then even in terms of identifying what program might be a good fit for the senior population, there's so many programs out there. They address different health issues, and it can be difficult to determine what program might actually be the best match for the population you're working with. And finally, it can be difficult to maintain program fidelity over time. Program fidelity, for folks who may not be familiar, is basically how well you're following the program model that's been established. So different challenges common to community-based organizations like staff turnover or funding changes can make it difficult to have folks that are sticking to that program model. So this section of the presentation, we're going to talk more about what's the actual scope of work that we're looking for in the RFP. So this RFP seeks to fund health promotion programs that directly serve seniors, which the levy defines as people 55 and older. And these programs must take place predominantly in community and home settings as opposed to clinical settings. And we're planning to fund 3 different program types. Existing evidence-based senior health promotion programs. And whenever we're talking about evidence-based senior health promotion programs here, we're following that definition for the Administration for Community Living. New evidence-based senior health promotion programs, including programs that are working towards identifying a specific evidence-based program model or adapted evidence-based program model that matches the needs of the senior population they serve. And the third category is existing or new senior health promotion programs that serve senior populations for which existing evidence-based senior health promotion programs are high barrier, few or non-existent, that are aligned with the social and cultural context of the seniors they serve, and that are willing to incorporate an evidence-informed approach into their program delivery. And when we say incorporate an evidence-informed approach, we mean using evidence to inform program activities and goals. We're going to talk a little bit more about what supports will be available to do that. So the areas of health promotion that we're funding with this RFP, examples are falls prevention, physical activity, healthy eating, medication management, chronic disease management, social connectedness, stress management, behavioral health, and other health-related issues relevant to the senior population being served. Two things to note is that falls prevention is a priority for this RFP, so that's going to be one kind of program we're definitely going to be funding. We're not only going to be funding falls prevention, but that will be one of the kinds of programs. And then also on that list of evidence-based programs, caregiver support programs are on that list, but we are not going to be funding caregiver support programs because the levy has other investments supporting caregivers. In terms of what you're eligible to apply for with this funding, it's really anything that supports the operations of the program you're proposing. So some examples are staffing costs, costs for licensing, training, materials, and equipment associated with a specific program model, program startup and development costs, like a needs assessment, program model research, costs associated with the use of a physical program space, renting a space, or maintaining a space, outreach, marketing, and promotion costs, partnership and consultation costs, like partnerships with other providers or consultations with clinicians, volunteer management and support costs. A lot of programs rely really heavily on volunteer leadership, so kind of various things that might support those volunteers to engage. Costs for program components that enhance participant access and encourage participant engagement, and costs for supplemental program activities that support a holistic approach to health promotion. So that might look like providing fresh produce bags for participants, connecting participants with other health-related resources, things like that. You may have seen in the announcement that we're also funding through a separate RFQ, a program supports provider. This will be one entity that will have expertise in evidence-based senior health promotion programs and health intervention for diverse communities of seniors. And the role of this provider will be to support these programs to really strengthen their work and strengthen their connections to evidence. So we're not totally sure what that's going to look like yet and what kind of supports they're going to provide. It's going to depend on what the needs are of the programs we fund through the RFP and what the particular expertise of the awarded entity from the RFQ is. But we are planning to, and it may not be available for all the programs we fund through the RFP, but we're planning to prioritize the programs in the categories 2 and 3. New evidence-based programs and programs newly incorporating an evidence-informed approach with support from that awardee. Focus populations. The senior health promotion programs funded under this investment must serve seniors defined by the VSHSL as persons 55 and older who live in King County, and programs that serve senior populations experiencing health and healthcare disparities will be prioritized for funding. This is our total funding. The levy is through 2023. So with the levy funding plus the ABS funding, it's about $6.4 million. And applicants can submit funding requests for up to $200,000 annually. There are some additional parameters for the ADS funds, which are outlined in the RFP. For example, ADS funds are for folks 60 and older, and they can only be used towards evidence-based programs as federally defined. Our plan is to try and sort that out during the award process and just try to minimize, fund a small number of providers with the ADS funds so that we minimize the kind of different requirements and different restrictions associated with the different funding streams. I wanted to show, so programs could apply, applicants can apply for funding for a single program or for multiple programs. There's 2 different budget templates depending on what your application is. So I just wanted to show those real quick. And these are all on Zoom grants, which we'll go to in a minute. But they're pretty similar. This is the single program, so you just put the estimated cost for the single program, and then this is for if you're applying for multiple programs. This has space for up to 3 programs. If you could fund more than 3 programs if your proposal is to fund for more than 3 programs, then you can edit this and add more spaces. Another thing to note about the budget is that the contracts are anticipated to start July 1st of this year. So this will be a shorter program year than the other program years through 2023. So we know that might mean there's different costs in this first program year. There might also be more costs associated with startup of a program. It will depend on the specific programs. But the budget forms have spaces here to put the 2020 budget and then the 21 through 2023 annual budget. In terms of evaluation, all the levy investments have an evaluation process where after the contracts are developed, we have a team within our department that works with the contractor to develop performance measurement and evaluation plans. And those performance measures are actually separate from the contract. So that process will happen with the awarded organizations after contracting is over. And the PME team works with the provider to develop a set of performance measures applicable to their program. We know that a lot of evidence-based programs do have evaluation systems and measures in place already, so they will work as much as possible to align those measures with what's already in place if the program is an evidence-based program. Since the work of the program supports provider that's being funded through the RFQ might also involve evaluation support, the plan is also to coordinate that as much as possible. And then in terms of reporting, once the PME plan is in place, that will determine a lot of what your reporting requirements will be, because you'll be doing reporting related to those specific program performance measurements. But generally, we will expect most programs to collect client level data, as well as do some aggregate data collection and provide narrative reports on an annual basis. The ADS programs also have the programs funded with ADS money will also have some specific data requirements. I don't know if you all want to speak to that a little bit.
Yeah, so a lot of it aligns with our client level data that is already collected with the county. And I think there are some other things that are in the RFP where you might find more information about the client level data that we need for our reporting requirements as well.
And we really will kind of dive into that after the award process, so you don't need to worry about it too much now, but it's something to be aware of, that this will be part of the work that you are expected to do if you get awarded these funds. So in terms of the timeline, the RFP opened on the 14th. Today we're having the bidders conference. Technical assistance, which we'll be talking about in more detail in a second. We ask that you request technical assistance from those providers by March 16th, which is 2 weeks before the RFP closes. The last day to submit questions related to the RFP is March 23rd, a week before the RFP closes. And then the RFP closes on Monday, March 30th at 11:59 p.m. In April, our review panel will review the applications and make funding recommendations. We may choose to do interviews with applicants if necessary. And then we anticipate notifying folks of our award decisions in May and starting contracts July 1st. So I want to pull up, let's see, well, actually, we're going to look at Zoom grants in a second, but these are the basic things that will be required to complete your application. We have a summary questions area on our online Zoom grants platform, which is just basic information about your organization and budget level and location. Then we have the narrative questions, which is really the meat of questions about what your program content is. We did upload a revised narrative question document today. So if you have downloaded the old one, please note this is a new one and you should use this new one. It's the same content, but we inserted text boxes with character limits on there so that we can have a better kind of handle on the length of applications. And then you'll also need to upload a budget, either the single program budget or the multiple program budget that we were looking at earlier. And then there's also a part of the Zoom grants application where you complete an equity chart about your staffing and board and volunteer kind of demographics. The rating criteria, this is how the review panel will score your applications. This is in the RFP. So I'm gonna just pull that up real quick. This is the rating criteria page. So you can see there's kind of like a detailed description of what we're going to be looking at. The description here represents like the kind of strongest possible answer. And these all totally align with the narrative questions. So you'll see like there's a question that asks about your experience doing senior health promotion work. And then this is the kind of criteria we'll be using to evaluate that response, and so on and through the end of the rating criteria. So technical assistance. For small organizations, which we define as organizations with less than 20 full-time equivalent staff, you might have more than 20 staff, but they'd have to add up to 20 full-time equivalents, or less than 20 full-time equivalents, 19 full-time equivalents, and less than $4 million operating budget in the prior fiscal year, you're eligible for technical assistance support. Attachment D of the RFP has a list of the consultants we're using for technical assistance. So folks are welcome to, you can get in touch with them, get their support. They've really done a lot of these RFPs and have a lot of expertise in this process, so they can help advise you. And as we mentioned, please contact them by March 16th, which is 2 weeks before the RFP closes.
Virginia, can I say a little extra on this?
Yeah, please.
So just so everyone's aware, these people, they're very well versed in what we've been doing thus far with the levy. So if you find that the language is confusing, that Zoom grants is tough, or the budget sheet is so difficult, any of those technical pieces all the way to how does your program fit with what we're asking, the whole gamut is available, and we want to really encourage you all to make sure and utilize them. They're a great resource, so whenever Virginia can't answer a question, they can definitely help you sort of filter through.
Yeah, and they can provide a level of support that we can't. We can answer questions about the RFP content, but they are really there to kind of walk you through the process and work with your specific proposal and with your organization. Okay, so Zoom grants, that's the website where we post all our RFP materials. That's where you'll need to create an account on Zoom grants and submit your application materials through there. I'm just gonna pull that page up so that you can see it. So this is kind of the general information about the RFP and the deadlines and the requirements. I know this is very tiny, so probably can't really see this, but just to orient you a little bit. The library, which pops up automatically when you open the pages down here, And this is where all the attachments are, the RFP, the questions, the budget forms, the information about the technical assistance providers. And then one thing that's, if anyone has applied for other VSHSL funding, for most of our other RFPs, both the summary questions and the narrative questions, you fill out through an online form on Zoom Grants. But because of some of the restrictions on Zoom Grants around how we could ask the narrative questions, for this RFP, you actually fill it out in a separate attachment and then you upload it. So that's just something to know. Hopefully that's clear when you see the page, but it's a little different than most of the other RFPs. You'll need to upload the narrative question and the budget, and then everything else you'll answer directly on Zoom Grants.
Question. On Zoom Grants, can we start part of it and then save it and then come back to it?
Yes, you can, yeah.
Could you repeat the question, please?
Oh, sure. The question was on Zoom Grants, can people start an application, save it, and come back to it? And the answer is yes.
So it's more like a hypothetical question. So if we have two community agency joint effort or collaboration efforts, who will be the organizations based on what criteria to submit the applications?
Let me answer that question in just a second. We're almost finished here, and yeah, we'll answer that question first. I just want to wrap up here. Okay. One more thing that we just wanted to take the opportunity to mention, something that we heard at our community planning sessions was a lot of people brought up issues of mental health, and there's another RFP that's open right now from the Department of Community and Human Services. It's not part of the Veterans, Seniors, and Human Services levy, but I think it speaks a lot to some of the issues that people mentioned. Unfortunately, it's on the exact same timeline as this RFP, so it also closes on March 30th, but a few hours earlier. So I just wanted to mention that here. It's called the 2020 MID. MID is another levy, I believe. Sales tax to support mental health programs. 2020 MID community-driven behavioral health grants seek to catalyze small-scale and time-sensitive community behavioral health interventions that address wellness, substance use, and other mental health needs of immigrant, refugee, and indigenous communities, as well as other communities of color in King County. This is not specific to seniors, but just in case it might be something that has relevance to your agency or program, we wanted to let you know about this funding opportunity. It's for 1 year, and there's kind of different levels of funding. So you can read more about it at the link here. All right, so now is the time that we have for questions. Actually, sorry, before we get to your question, there was a question emailed before the bidders conference today that I just want to address, and then we'll get to questions and we'll start with you. So Dagmar, that was actually your question. Yes, do you mind saying the questions for the group, and then we'll repeat them?
Sure. If my question was, would the existing senior center hubs be able to submit proposals as a group of their hub group? And if that were allowed, would there be separate contracts for each one of the entities that were part of the proposal coming together?
Okay, so the question was, would existing senior hubs, which were funded in a VSHSL strategy last year, be able to apply together as a group for this RFP? And if so, would they be able to have separate contracts if they were awarded? So to the first question, yes, a senior hub would be able to apply as a group. And to the second question, we're not sure yet about what the contracting process will look like. We'll have to determine that during contracting. Can you see your question?
Sure.
Thank you.
So just more like a hypothetical question. So in case two different organizations going to partners to submit an RFP, so who will be submitting the RFP or complete the grant applications, or both organizations have to submit on separate? application.
So the question was, if two organizations are partnering to, on a proposal, would they need to, how would that work? Would one need to submit it, or would they both need to submit? You could choose one organization to submit a proposal, and it's up to you which one. Yeah, if it's the same proposal for a shared program, I think it's rather than two different applications, one organization should submit it, but you can choose which one. Yeah.
Could you go to slide 18, which is the scope of work question that talks about the 3 program types to be funded? So I have 2 questions about this. I understand the number 1, existing evidence-based programs, but the one that says new evidence-based programs, including programs that are working towards identifying a specific evidence-based program model, I'm having trouble understanding how it can be evidence-based until it's been evidence-based. And so the distinction between 2 and then 3, which talks about evidence-informed approaches. So let me just ask that question. And the second question is, when you say you're going to fund these 3 types of programs, are you intending to have each of them included, or are you just saying it could be any of these 3 approaches would be considered? And so you potentially, for instance, except for the money that has to come from the federal stuff, fund all of item 3 as opposed to item 1 if you wanted to.
Great, thank you. So the question was, I'll say the first question first and then the second question. So the first question was some confusion about this second program type under the 3 program types to be funded. How is a new evidence-based program different from a program that would be incorporating an evidence-informed approach that's not currently evidence-based? Yeah, so I think that's a fault of the clarity of the language here. When we're existing evidence-based programs would mean like a program that's already organization that's already operating an existing evidence-based program. New evidence-based program would be an organization that's newly doing an evidence-based program or starting a new evidence-based program that they've never operated before. And the second question was, so we say sorry, can you repeat the question
So it
again?
says 3 types to be funded.
Okay.
Does that mean that you were definitely going to do 1, 2, and 3? Or does it just mean that it has to be one of these 3 and you're not definitely going to fund, for instance, those from 3 because you get all 3 existing evidence-based programs?
Yeah, so the question was 3 program types to be funded. Does that mean we are going to fund all 3 of these program types, or it could just be 1 depending on the applications? We're seeking to fund each of these program types, but it will depend on what applications we get and which ones show up strongest according to our rating criteria and the discussions of the review panel. So it's possible that we wouldn't fund all 3, but our intention is to fund all 3.
Is the application process requiring separate applications per program type? Or let's say we currently do 1 or 2, can we hybrid them in 1 application, or are you thinking 3 different applications?
The question was, is the application requesting separate applications if you're applying to do multiple program types? And so the answer is no, you don't need to do separate applications to do multiple program types. In the narrative questions, there are questions that are specific to your program type. So depending on what program type you're applying for, you'll need to answer the questions relevant to that program type. But you can, if you're applying for multiple program types, then you can answer the questions for multiple program types in that narrative question section. Does that make sense? And then same with the budget, you can use the multiple programs budget form to put your budget for multiple programs, and that includes if it's multiple program types.
So this is a follow-up to the first question about if 2 organizations collaborate. And you said you can decide which one you want to be the prime contractor. In some grant programs, the prime contractor typically or often has to keep most of the funds. Is that an issue here, or for instance, could a small organization apply as prime, but then subcontract with a larger organization or collaborate with a larger organization to do, say, the majority of the activities?
I'm not totally sure I understand your question. Could you?
Yes.
Yeah.
Suppose you have a small organization and a large organization that want to collaborate. The small organization may want only to keep 20% of the funds because they have 20% of the population, and the large organization might require this 80% of the funding, even though the small organization wants to be the prime contractor. Is that permissible? Or, as is the case in some programs, the prime contractor actually has to be the major implementer of the program?
So the question was, let's say, for example, there's two organizations that apply. One is a small organization that's applying for 20%. They're applying together. One small organization that would use 20% of the funding. Another is a large organization that would use 80% of the funding. Does it have to be the large organization that is the primary applicant and holds the contract? I don't think it does. I think it's up to that partnership of organizations to decide how they want to configure that. But I'll look into that, and we'll post the answers to these questions as a document afterwards. So if we get a different answer, please refer to that document and look at that. But I believe that would be up to the organizations to decide.
I have a lot of questions specific to the narrative and maybe the budget around where are you looking for, or where is our opportunity to tell you what we're actually going to do? So I'm reading a lot of these narrative questions as like, what are we doing already? But I'm not seeing a great place to say this is what we're going to do with this additional funding, knowing that the goal is to increase access. Do you see that coming in only in the budget, or am I missing that somewhere in the narrative?
The question was, I'm not seeing where in the narrative questions programs get to propose what they'll actually be doing with this money. And am I missing that, or is it just in the budget narrative? Let me pull up the narrative questions here. My answer is I think that might be a misreading of the narrative questions. Okay. So there's this kind of first two questions asked about an overview of your organization and kind of your experience and expertise providing health promotion programming for seniors. And then when you go hard to move this mouse from screen to screen, sorry. Just a second here. Okay. So this population description, those are about the population you'd be serving with your program. I see how the tense might be a little confusing, but really that's all about who is the population you'll be serving in the program you're applying for funding for. So that's about what you'll be doing with this money, who you would be serving. And then when you go further down, this program description, that's really what will you be doing, what are the activities of your program in this program that you're applying for money for. So that's really about that's all about this program that you're applying for money for those parts of the narrative.
Yeah. So, okay. I imagine most of us, I mean, we're doing the work that we're doing already, and we're applying to these funds in a way to either expand our capacity or reach. Mm-hmm. If it's not in that new program category.
Sure.
So that's where I guess there's a lot to be read into this. With these funds will allow us to do X, Y, and Z. So those specific amounts and like specific outcomes, I'm also not seeing a place to provide that for you. Is the budget that you're looking at, are you seeing that as the program budget, meaning this is what we're asking for? Okay, and
Yes.
what about outcomes? So sorry, there's a lot, I'm not trying to tack on too many questions, but the third part of that I think is all related to the outcomes. You mentioned that contracting would be the time. So is that a conversation, or where are you getting the metrics from that?
So the question was about outcomes, where part of the application has information about outcomes. In terms of the application process, really the parts that ask about that are pretty broad. It's basically like this question 8, what positive health impacts will seniors experience when participating in this program? In terms of specific measurements, we don't have any at this point. That's not part of the RFP. That's what will be, performance measurements will be developed through the PME process, which will happen after we're contracted. Does that answer your question?
How are the performance measures? Like, how do you do that?
I just want to encourage people that anything related to contracting and everything is a partnership discussion between
Gotcha.
King
That's what I was
County and
looking
you.
for.
And
Thank
right
you.
now, we just want you to apply with the program you want and answer the questions to the best of your ability. And know that any PME plan or outcomes discussion or measurements is in conversation with you, and we're not going to slap it onto you.
I didn't figure that.
Hello? Can you hear me?
Yes.
Can I ask a question, or am I cutting somebody?
Let me just repeat what Adam, did folks on Skype hear the answer to that? What Adam just said? Okay.
Yeah.
Great. Okay, so Phil, please go ahead.
Okay, in terms of what Adam was just talking about, if we already have a somewhat robust, not extremely robust, but somewhat robust M&E for our health and wellness activities for seniors, do you want us to mention that and that we would be really grateful for technical support, or should we not even go into that?
So you're saying that you already have performance measures
for
your program, and you're asking if you should mention what those are, and also maybe that you would really appreciate technical support around.
Yeah, because M&E is always great. It's like the more the merrier in my book.
Yeah. There is a question that's in the narrative questions regardless of program type about how you might use the program supports that are being funded through the RFQ. So you're welcome to talk about that there.
Okay.
There's also this question, number 8, what positive health impacts for seniors experience from participating in this program, which you will answer regardless of what program type you're applying for. It also asks, how will you measure or assess those impacts? So you can, if you already have this is for an existing program and you already have measurements you're using, you're welcome to talk about that in that question.
Thank you.
We'll take a few more calls just in case. I'm sure there's others on this kind of call too.
Yeah, we have about, we're good on time. We have about 30 more minutes. So yeah, other folks on Skype who have questions?
I have a question. This is Bonnie Olson with Emerging Design Consulting. And in questions 4 and 5, you ask people to talk about the prevailing health issues with their population and also health disparities. Is there any links, data links that you could provide so people would know where they could look for health disparity data?
That's a great question. I think we can look into that and get back to you. We have provided some information like that for other investments, but we don't have anything in place right now for this. So yeah, we'll look into that and get back to you on that.
Great, thank you.
So where will you put that if you do end up sharing that information?
Thank you.
Hello, this is Jay, and I have another question.
Sure, just 1 second. Let me, Adam just asked kind of a follow-up question to that, which is where would we post the information like data about health disparities if we can produce that. And so we'll post it in Zoom grants. I'm not sure exactly where it might be I guess it would be as an answer to that question. We'll post a questions asked at this bidders conference document, and then that data will be posted as an answer to that question. Okay, go ahead with your question, Mia.
Jay, so this is Jay from KWA. The question is about the medication management. Does it have to involve any medical professional in terms of doing that?
We're not prescribing any particular thing about the program model besides what we've already outlined in the RFP. So we don't have any specific requirements around that.
Okay, thank you.
So the request per application is $200,000 a year for these programs.
Oh, yes. The question was, is the funding limit request $200,000 per year, regardless of how many programs you're applying for? And the answer is yes. Yeah.
So how many awardees you're gonna select?
How many organizations are we going to fund?
Yeah.
We haven't determined that. The question was, how many organizations are we going to fund? And the answer was, we haven't determined that.
Is the Zoom grant downloadable so I can like work with it as a Word document and then just cut and paste and put it in when I'm all done?
The question was, is Zoom grants downloadable so you can download it and answer the questions and then cut and paste when you're done? The library section of Zoom grants has all the attachments, which you can download. And then for example, the summary questions, you'll have to fill those out on the online form, but there's actually a separate Word document that you can download and fill that out. For the narrative questions, it's a Word document, but you'll be submitting the Word document anyway. So yes, you can, everything is downloadable, and then you can fill things out and upload them to Zoom grants as necessary, or copy and paste.
It's not really a question, it's just a point on a link in here, the evidence-based program list from NCOA that's on there. It was just updated, so about 4 or 5 programs have been added to it.
Great.
So I just want to make folks aware of that. So it actually will, instead of saying November 2019, it says February 2020.
Great, thank you.
Sure.
We'll update the RFP to reflect that. So Paige mentioned that the list of the link to the list of evidence-based programs on the National Council of Aging website was just updated this month, so we'll put an updated link on there.
So my question is, so for this group of work, so one of the bullet mentioned is the program is predominantly for community and home setting as opposed to clinic setting. But hypothetically, if there's a project related to, outreach and access for patients who attend the clinic, they're referring out to, community agency, would that be totally excluded from this RFP?
I may need to kind of come back to you with specific language around that. I would say, yeah, I think we'll have to oh, sorry. The question was, it says that we're funding programs that are predominantly operating in community and home settings as opposed to clinical settings. Would a program that's involving clinical patients, but that involves outreach to community-based programs, would that be automatically excluded? I think we'll have to get back to you on that. I'm not sure how to, the emphasis is on programs that are not in clinical settings, but in terms of like what that specific threshold is, yeah, I think we'll have to get back to you on that.
Thank you.
Other questions from the folks on Skype?
I do have one actually to read out, if you don't mind. So Katie asks, what if you currently have a program that meets some of the ACL evidence-based criteria, but does not meet perhaps one or two components of the criteria? That's the first question. Would you apply as a current evidence-based program or one of the other options?
I might call on Mary Pat is that a scenario where a program would meet most of the ACL criteria but wouldn't qualify as an evidence-based program?
Yes, but there is an evidence-based program that's called Home Meds. So there are elements of an evidence-based medication management program. So I think it's looking at what the criteria is from NCOA or ACL, Administration for Treatment Living, and saying, what are those elements? Because one of the things that you've mentioned is it's evidence-based, but also kind of like evidence-informed. And some programs are just at the threshold of getting approved by ACL.
Yeah. Thank you, Mary Pat. So Mary Pat was talking about, yes, there are programs that do meet a lot of the criteria but don't meet all of them. I think we would say we're going to keep that definition pretty clear so that programs that match that definition should apply under that program type. Anything that doesn't match the definition, regardless of whether it's close or not, should apply under the other program type. And you can describe if it's close. What were you going to say, Angela?
So I would just add that if your program is included in the list, then apply as an evidence-based program. If your program is not on the list, then don't apply as an evidence-based program, as another category. Makes it clearer.
Yes, yeah. So Angela was saying, if your program is included on that list of evidence-based programs, you should apply as an evidence-based program. If it's not on that list, then you should.
I mean, evidence-informed.
Yeah. Apply as an evidence-informed program.
So on page 6 of the RFP, in the second paragraph, we say an evidence-based program can be adapted or customized to make it more suitable for a particular population or setting. And we've actually had this experience where we've offered evidence-based exercise classes, but for the population of low to moderate income seniors, the CHEC serves, those programs have been too advanced. So we've had to adapt the program in order to make it of interest and to keep our residents attending the programs. And we've had a lot of success by this adaptation process. So can you clarify that a little bit in terms of, would this be something you would see as fundable? If part of our work would be to adapt an evidence-based activity program.
So the question was, SHAG has operated programs where they've adapted some of the characteristics of the program and they found it to be successful. And would that qualify as an evidence-based program? I think when we're talking about adaptations, we are talking about kind of the formal process of working with the program owners to do adaptations that are approved by the program owners. So if the adaptations that you're talking about haven't gone through that formal process, then we wouldn't put that in the category of evidence-based, even though it might be very close. But part of the aim of having this program supports provider is to help maybe navigate that process of working with a program owner to identify and get adaptations approved. And the reason that is because that's kind of what determines the threshold for being an evidence-based program, that it's been tested in a particular way and proven effective. So that's why those changes need to be approved by the program owner to maintain that effectiveness.
So if we were able to do that, then we would still be considered fundable.
Sure, and you could apply. If that's part of your proposal, you would want to go through that process, you can include that in your proposal.
Thank you.
Other questions?
not a question, but just a comment. Thank you for the comments about the evidence-based program. One of the things, particularly for living well with chronic conditions, Dr. Lord is very specific that the program fidelity has to be followed in order to call it that program. And I'm sure Paige would say the same for Matter of Balance or Enhanced Fitness, that in order to call it a program that has been the highest tier program, it has to be followed for fidelity. And as you mentioned, Tamando du Salad and Wisdom Warriors, it's been adapted culturally, that sort of thing, but it has been vetted as far as the fidelity. So I just want to throw that out. It's very possible that it meets whatever criteria it needs to meet, but I think the big thing is the fidelity. As it gets further and further away from fidelity, and then the program sponsor or the owner of the program or the trademark says, you're not doing that program.
I would just add in support of what Mary Pat just said, and it's not, I mean, although certainly the trademark's very important, but with the program, it's really about the outcomes for the participant, right? And as you start moving away from certain protocols, we know lots of things work. We know the things on the evidence-based program work and are replicable and why, right? So there's been a lot of testing that's gone into that. So we call that adaptational fidelity. Yeah.
Folks on Skype, other questions? All right, well, anyone here have the questions? Okay, if you do think of other questions, please feel free to reach out and contact me. So my email is on the RFP materials, but it's right here, VWEIHS@kingcounty.gov. And it takes some time to go through an internal review and approval process for the questions we post. So it's not immediate replies, but we will post them. And also during the open RFP period, we're not allowed to have individual conversations or answer questions on an individual basis. So any questions that you submit, we'll acknowledge that we received your question, and then we'll produce a response, but it's going to be posted publicly on the Zoom Grants website, so it's available for everyone to see and read. All right.
Thank you so much.
Thank you.